20%, listen to this, of all deaths in Sullivan County last month, 20% were attributable to opioid abuse. That's a frightening and tragic statistic. But every one is a human life lost. Not just a human life lost, they leave family and friends and people in the community just with a hole in their lives forever. Tragically, though this is not unique for our community, Sullivan County has the highest opioid overdose death rate in all of New York State. I am here today to launch a two-pronged plan to beat back the opioid crisis and stop the surge of dangerous drugs trafficked into both Sullivan County and throughout the whole Hudson Valley. First, despite this epidemic, Sullivan County is the only place in the Hudson Valley that doesn't have a critical federal designation called HIDA. High-intensity drug traffic areas membership. It's a great thing. I'm going to explain that in a minute. But today I'm immediately calling on the director of the Office of National Drug Control Policy to approve Sullivan County's request to make the county a HIDA member. Over the years, HIDA has provided millions of dollars to upstate New York's law enforcement agencies. And the Hudson Valley was one of the first to receive HIDA funding way back in 1994. But Sullivan County was left out and still is. HIDA is a special program that brings with it federal resources. One of the things, and the sheriff will tell you this, is federal intelligence sharing. In other words, if there's a whole bunch of drug dealers and they're coming up and targeting Sullivan County, even though they may be from out of state, the feds can alert our local folks and work with them to stop them from coming or deal with them effectively when they come. And the federal government can do drug investigations. You know, sometimes there might be a big ring that crosses county lines but is needed here. They can do that as well, and the long arm of the federal government can work. The second prong, we're calling for a historic $3.2 billion increase in funding National Drug Control Program agencies in the upcoming federal budget. I fought hard to increase this funding that combats the opioid crisis in the American Rescue Plan. We got $1.5 billion in the Community Mental Health Block Grant and $1.5 billion in the Substance Abuse Prevention and Treatment Block Grant. And those are sent Catholic charities throughout the country, and I'm sure here in Sullivan County has benefited from some of these fundings. We need these monies because the problems with mental health and the problems with opioid addiction have skyrocketed since COVID. But they're going to stay with us. COVID may go away. They're still going to be here, the problems. And so to give money to places like Catholic Charities is good. And in fact, Catholic Charities received the first round of SAMHSA grants to become a center of treatment innovation for state-targeted response.
We need resources, including HIDA designation, from our federal partners. I'm pleased that Senator Schumer is here today and has long recognized this dangerous situation and is committed to working together with us to save lives.
Senator Schumer being here to bring federal resources to bear is a huge contribution. We at the state, Aileen and I, are focused on making sure we deploy those state resources in a good way. And certainly thank you to our many partners here at the local level, because without all of us working together on this important issue, we would not be successful. So thank you, Senator.
Thank you, Senator.
We appreciate your support.
Thank you.